Today we discuss something about backache. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Lower backache. So many of the patients who come to me have lower backache and it's very difficult to explain the entire anatomy. So I simplified it and made simplified version and I hope it's helpful to all. So lower backache can be due to pain in the bony lumbar spine, discs between the vertebra, ligaments around the spine and disc, spinal cord and nerves, lower back muscles, abdominal and pelvic internal organs, and skin over the lower back. Upper backache is due to the disease of aorta, chest tumors, and spinal disease. Due to the anatomy of the body, upper backache is not very commonly seen. Occasionally we do get patients, but yes, upper backache is not common, and flexibility of the spine is more at the lower part of the back, and that is why due to the flexibility we have to pay the price. So let us see the vertebra. This is the side view and this is the front view. These are the vertebral bodies. This is how it looks in from the front and this is how it looks from the side. It's a simplified version. So these are the vertebra. Now in between the vertebra there are these intervertebral discs. So when you bend forwards, these two vertebra come closer and this causes pain. And these protrude out backwards. Okay, these are the intervertebral discs. And at the back there are nerves. These are the nerves which are affected. So these vertebral bodies, these bony parts, these intervertebral discs and nerves, all these can cause pain. Now they are held to each other in position by these ligaments. Again, if there's stressing of these ligaments, again there may be pain. Again, this is the side view, this is the front view. Above the ligament, there are muscle fibers. They're in all directions. And again, stretching of the muscles can also cause pain. Apart from this, you have the abdominal organs, which can cause lower backache, and also the skin can also cause backache. So we have to find out what is the condition. Now let us have a look at the vertebra body from the top. So this is the top view, this is the body, this is the part which I had shown just now. These are the nerves coming from the side, both sides, and this is the spinal cord. Over you can see the spinal cord, and this is the intercostal disc. The same thing with yellow one which I had shown just now. Now whenever you move forwards, bend, then this touches the back and this causes the problem. Or a part of the disc may touch the nerve either on the right side or left side. And again this causes, when it touches the nerves or spinal cord, it causes backache. And this is careful because if we don't keep maintain our posture, then we'll get backache. I made 4 videos already on posture. Duration. Acute pain starts suddenly and persists for up to 6 weeks. Chronic pain over 3 months. Causes. Again, injury, activity, posture, and disease. These are the various causes of backache. Strain. Strained muscles, muscle spasm, muscle tension, damaged discs, injuries, fractures of walls, and again activities such as lifting something inappropriately, lifting heavy weights, or making sudden and awkward movements. Faulty posture such as twisting, coughing or sneezing, muscle tension, overstretching, bending inappropriately, pulling or lifting, pushing or carrying something. So all these can lead to backache, especially if there's some weakness. Standing or sitting for long periods, especially if you're traveling in a car or something. Again, maintaining inappropriate posture while working on computer, TV, mobile or driving. Sleeping on an uneven mattress can also cause backache. So these are various causes. Sometimes the patients have problems in the spine, structural problems. So ruptured discs, bulging discs, Sciatica, that is compression of the nerves. Arthritis, abnormal curvature of the spine. Osteoporosis, and kidney problems. So all these can lead to structural problems. Kidney problems lead to depletion of calcium in the bones and then will make the weak bones. Again, osteoporosis, abnormal curvature of the spine, arthritis, sciatica, bulging discs, and ruptured discs. There are other causes also, such as disease of the spine, compression of the spinal nerves, cancer, infection, sleep disorder, and herpes zoster. I will not go into these details. Various risk factors associated, such as occupational activities, pregnancy, sedentary lifestyle, poor physical fitness, elderly people, obese, smoking, lack of physical exercise, and genetic factors. So all these factors are risk factors for having backache. Patients may have various symptoms such as ache in the back or which may go to the buttocks and legs. But still many patients, they have backache and they don't feel the need to go to the doctor. So if you went to visit the doctor, if there is backache and you have significant weight loss, fever, redness or swelling of the back, resting does not reduce the pain, persistent backache, pain reaching the legs or knees, unable to control the urine or feces, difficulty in urinating, numbness in pelvic area. So whenever you get any of these symptoms, definitely you are supposed to visit the doctor for backache. Investigations. Again, basic investigations are the X-ray, MRI or CT scan, bone scan, EMG. Other tests may be done. Treatment. Sometimes you take the painkiller tablets, you will take the rubificients, counter irritants, apply them and they may reduce the backache. Physical therapy such as heat or ice, ultrasound waves, electrical stimulation, then you have the transcutaneous electrical stimulation, TENS, and steroid injections may be used for backache. Traction is also used. Botox injections can be used. Surgery, there are different kinds of surgery that can be used for backache: fusion, artificial disc removal partial, and laminectomy. This is a part of the vertebra which I have not described. Prevention: do a regular exercise, diet, maintain the diet, quit smoking, maintain the adequate body weight, and you maintain your posture properly. So all these ways you can prevent the cause backache. Thank you for watching the video. Do not forget to like the video. Please free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.